Today's guest has spent more than 13 years inside one of India's most respected diagnostic imaging, Ms. Promila Kundliya.
I still feel the core of everything is in healthcare is trust and empathy. They are extremely important.
So, from inside the industry, tell me, what is the conversation diagnostic chains and their boards aren't having honestly enough?
Industry still avoids that honest conversation between growth and ethics. Healthcare cannot become purely commercially driven.
Hello, everyone, and welcome back to FaceTime with Leaders, powered by Directors Institute, World Council of Directors. I'm your host, Sunny Pancholi. Now, most of us have walked into a diagnostic center at some point in our lives for an MRI, an ultrasound, a CT scan. We almost never think about who is running that place. Today's guest has spent more than 13 years inside one of India's most respected diagnostic imaging and labs networks, Mahajan Imaging, rising from general manager to senior vice president. Before this, she ran her own travel business as CEO for nearly 9 years and earlier handled administration and finance for elevator and infrastructure companies. 25 years of leadership across very different industries. Joining us today is Ms. Promila Kundliya. Ms. Promila, welcome to the show. Glad to have you with us today.
Thank you so much for such a warm welcome. It is truly a pleasure to be here with FaceTime with Leaders. So, my professional journey has been quite diverse, as you have already mentioned, from administration to travel to healthcare leadership. But, Sunny, one thing which remained constant throughout my journey was working closely with people, solving challenges, and building systems which can create meaningful impact. And for last 13 years, in fact, more than 13 years, I've been working with Mahajan Imaging Labs. And I have had the opportunity to work towards operations, patient experience, patient care, business growth, developing new infrastructures and projects. It has been quite exciting. And one has elevated from general manager to senior vice president for the company. So, healthcare is something that constantly teaches you empathy, resilience, and responsibility. And I've had the experience to work with India's #1 imaging and labs company, Mahajan Imaging Labs, where the focus is at innovation and patient-centric approach. So I'm looking forward to this conversation.
Absolutely. Looking forward to an exciting conversation ahead. So let's dive right in. All right. Here's something most people never think about. When a patient walks into a diagnostic center, they are already nervous. They are waiting for news that could change their lives. So, after 13 years inside this work, what does that waiting room look like to you now?
That's a wonderful question and very close to my heart. So before I joined healthcare, to me, any waiting room in a diagnostic center was just a space where you wait for your turn. But after 13 years at Mahajan Imaging Labs, I see it differently. Now I see emotion sitting in that room: fear, anxiety, uncertainty, courage, and at times relief. I see small things like a parent holding a child's hand, an elderly couple waiting for their report, a family waiting for their report and trying to read the every expression on doctor's face. So we often don't realize that people don't come to a diagnostic center for leisure or for shopping. They probably come here at the most vulnerable moment of their lives. So for me, they are not waiting for a report. They are actually waiting for that reassurance, for that trust. So at Mahajan Imaging Labs, we constantly tell our teams to be uh, extremely sensitive about this. They are not handling scans and report. They are handling human emotions. And at our waiting spaces, we give a lot of heart and soul in bringing them up, be it in terms of comfort, decor, colors being used. At times, it gives me immense joy when I see somebody taking selfies in our waiting areas. So, थोड़ी देर के लिए, if they can forget their illness, we have achieved it. So for me, the waiting rooms, the waiting areas are not just operational space. They constantly remind me that diagnostics, healthcare is ultimately about empathy and trust.
Absolutely, absolutely, Ms. Promila. And honestly, most of us have walked into those waiting rooms and never thought about the people running them. So thank you for showing us that side of it. And what a great start to this conversation. So
Thank you.
uh, let me remind of something bigger. Diagnostics is one of the most invisible parts of Indian healthcare. Patients see the doctor, but the entire treatment plan hinges on the scan and the reports. So tell me honestly, do you think Indian boards and policymakers give diagnostics the seriousness it actually deserves?
You are absolutely right. Honestly, diagnostics is the most important part of the healthcare, yet under-recognized. Patient often remember the treating doctor, but the entire clinical management, the entire disease management depend on that scan and that report. So I'm not exaggerating by saying it that diagnosis is where your clinical journey truly begins. So India has definitely started giving more importance to diagnostics, especially after pandemic. Uh, but I still feel there is a lot of room. This sector deserves that that attention of policymakers, that discussion on the boardrooms, that diagnostics is no more a support service. This is, in fact, the most important factor in deciding the clinical management. And good thing is that awareness is increasing. Nowadays, patient is pretty aware. You can't just sell anything you want, right? So, and good thing is that hospitals, boards, policymakers, uh, they are putting little energy there, little attention there, but it still requires a lot of work in that field. Because ultimately, better diagnosis means better patient management, better outcomes for patients.
That's a fair answer, Ms. Pramila. You are not blaming the system, but you are not letting the industry off the hook either. Uh, so let me push you on that. We have watched listed diagnostic chains like Dr. Lal Pathlabs and
Hmm.
Metropolis face real pricing pressure and trust questions in the last 2 years. Customers are paying more, but they don't always believe what they are getting is worth it. From your seat at Mahajan, what is the diagnostic industry getting genuinely wrong about Indian patients today?
See, Indian patient today is not looking for just reports. They want that trust, that empathy, that reassurance, right? So, if they feel rushed or confused or disconnected, then even the best technology cannot save you, right? So I still feel the core of everything is in healthcare is trust and empathy. They are extremely important. So we have to safeguard that. Number two, the biggest challenge which we all are facing in healthcare is that healthcare has become too price sensitive. Somehow the focus has shifted to volumes, expansions, discounts, and all that. But diagnostics cannot be treated as a retail product or retail service. As I mentioned, people don't walk here for shopping. So, quality, accuracy, experienced radiologist, pathologist, patient experience are extremely important. So, at Mahajan Imaging, we strongly believe that technology alone cannot do it. It is extremely important, but we cannot miss that human connection. If patient gets that, there is these doubts vanish. Patient should not feel processed. He should feel cared for.
All right. So this brings me to my next question, and a very interesting one. Talking about AI. Globally, AI is already reading mammograms,
Yes.
CT scans, and X-rays with accuracy that matches senior radiologists. The radiology profession itself is publicly debating whether half of its work will be automated within a decade. So, from inside imaging, is AI a partner? Is AI a threat? Or something the industry hasn't honestly figured out yet?
See, I personally feel AI is not a threat. It is definitely a partner. AI is already helping you to improve the speed, accuracy, image quality, and especially in the areas like mammography, chest scans, emergency medicine. So, ये तो हो ही नहीं सकता कि AI replace कर दे radiologist को. This is just not possible. In fact, at Mahajan Imaging and Labs, we are already using AI, lot of AI-based tools to enhance the image quality, accuracy, and speed. It helps the radiologist to turn around larger numbers without creating that human fatigue. But it cannot replace. It cannot replace. AI can help you to detect the abnormalities much earlier, but you need a human figure to actually report it to the patient, right? So we have to understand that medicine is still deeply human. Still deeply human. A scan is just not about identifying the abnormalities. It is about understanding the clinical context, patient history, and then making required judgment. ह्यूमन एक्सपीरियंस और अकाउंटेबिलिटी को निगेट नहीं किया जा सकता. टेक्नोलॉजी कितनी भी एडवांस हो जाए, इंसानियत और क्लिनिकल जजमेंट की जगह नहीं रिप्लेस की जा सकती. सो आई बिलीव future is not AI versus radiologist or AI versus pathologist. It is AI working alongside radiologists to produce uh, better reports which are more accurate, more faster.
All right. Okay. So let's move on to the next segment, which is quick fire round.
Oh,
Short, sharp, gut answers, no overthinking. Are you
acha.
ready for it?
All right.
Okay, so here I shoot you with the first question. Standalone centers or hospital attached imaging? Which one wins in 2030?
Definitely standalone centers with better technology and patient comfortability. However, collaborations with hospitals are equally important.
Okay, that was balanced. Next one. Indian customers are willing to pay for quality healthcare. Yes or no?
Of course, yes. If they get that trust and due care, they are definitely willing to pay.
Nice. One thing every diagnostic center still gets wrong about the patient experience.
You have touched my heart. It's making patient feel like a transaction. We all have to remember in healthcare, patients are not just one another number. So treating patients like another transaction, it's just not right.
Great. Next one, AI in radiology, partner or replacement? We have already talked about it, but let's just justify this also.
Definitely a partner. Definitely a partner.
Okay. All right. Last one of the quick fire round. One word for healthcare leadership in India today.
I would rather give two words: innovative and progressive.
Great. So that was fun. That was quick. Thank you for playing along. Now we are moving to the next segment, and let me put your scenario in front of you. In 2024, the National Medical Commission flagged misleading diagnostic advertisements, and there have been multiple cases of fake or padded test reports surfacing across cities. Patient trust in private diagnostics has taken real hits. So, from inside the industry, tell me what is the conversation diagnostic chains and their boards aren't having honestly enough?
So, Sunny, I think industry still avoids that honest conversation between growth and ethics, right? Expansions, marketing, volumes, everything is very important. But healthcare cannot become purely commercially driven. This is one field where you cannot make it too automatic, too commercially driven, right? The reality is that there are, in fact, some misleading advertisement or unnecessary testing or compromised reporting standards, which don't affect a chain. It affects the entire sector. So, and the trust which is built over years get affected too. So we all have to understand that when such things happen, the honest operators at times have to take that burden. So this needs to be, whatever we can do about it. And this uh, second thing is that at boards, we need to discuss about ethics, compliance, and quality control. We have to make the system even more transparent to improvise the patient trust. See, at the end, we all have to understand trust is no more a soft value. It has become the core asset of any business, especially healthcare. At the end of the day, the report which is coming out is going to affect somebody's life, a family's decision, a doctor's entire management. So the responsibility of the whole thing still stays there, and it should be the center of any boardroom discussion.
Rightly said, Ms. Promila, and what a insightful conversation that we are having. So before we wrap up our session, one last thing to question you. You have led across travel, administration, and now healthcare for 25 years. You have clearly built leadership from the ground up. So what made you say yes to Directors Institute, and what has DI given you?
Oh, that's interesting, Mohan. So, my journey across the different industries from lift and escalator to travel to event management and to healthcare now, I've always believed that leadership is not a designation, it's a perspective. It's about adaptability, it's about creating meaningful impact. And in these 25 years of my professional journey, I have worked across operations, administration, business development, customer experience, healthcare management, and developing new projects and infrastructure. And throughout my career, I have believed strongly in creating customized solution rather than sticking to those conventional strategies and methods, because I believe every challenge requires that practical, people-oriented, forward-thinking approach. So I don't believe in what is being written should be followed all the times. There is every problem is unique, so the solution has to be unique too. So after 25 years of my operational leadership, I felt probably this is the right time that I should go beyond day-to-day execution and should be able to contribute towards the larger strategic boardroom engagement. So that is what attracted to Directors Institute, honestly. I think this platform will allow me whatever I have gathered in these years, whatever I have learned in these years, so that I can create meaningful impact at board level situation.
Great to hear that, Ms. Promila. There is a particular kind of leader who quietly holds an organization together. The kind that runs the center, manages the partnerships, looks after the people, and really takes the credit. And that is the work you have been doing for over a decade
Thank
at
you so
Mahajan.
much. That's too much.
And honestly, what stays with me from this conversation is the steadiness. Healthcare needs more leaders like you, calm, capable, and committed.
Thank you.
So, thank you so much for joining us and sharing your journey with us.
Pleasure. Pleasure was completely mine. Thank you so much for having me.
And for everyone listening, directors, founders, healthcare leaders, remember this: diagnostics is the gateway to every treatment decision in this country. The brands and the boards that take trust, accuracy, and patient experience seriously will be the ones we still rely on in 20 years ahead. The rest will simply be replaced. On that note, this has been FaceTime with Leaders, powered by Directors Institute, World Council of Directors. I'm a host, Sunny Pancholi, signing off for now. Until next time, stay curious, stay informed, and most importantly, stay healthy. Thank you so much.